All right. Healthcare in our country is a topic of constant debate. The U.S. healthcare system is unique among advanced industrialized countries since it is mainly privatized, except for government-funded healthcare programs for veterans, the elderly, and the poor. Many people and politicians today are looking for change in our healthcare system and want the U.S. to switch to universal health coverage. Universal healthcare is a single-payer healthcare system where all the costs relating to medical care, treatments, prescriptions, etc., are paid by a single entity, the federal government, and is provided to everyone in the country. Several nations, including Canada, Japan, most European countries, already have a single-payer health coverage program in place, and I understand why it sounds so appealing to Americans. Today, I'm going to tell you why universal healthcare in the United States would make healthcare worse in our country. I've already done extensive research on the subject, and I have carefully examined the short and long-term effects of different types of healthcare in the United States and abroad. I think we can all agree that healthcare is important and that we all simply want everyone to have good medical care at an affordable cost. I'm going to explain how and why a universal healthcare system in the United States would reduce the quality of care and make it more expensive, and suggest a possible solution for making healthcare in America better and more affordable for everybody. A universal healthcare system in the United States would reduce the current quality and availability of care, suppress future development of care, and it would cost more than what we are already paying. When you have the government paying for healthcare, you put medical decisions in the hands of bureaucrats. They get to decide, for example, how many MRI machines they're going to have in a hospital, whether or not they think that you're going to get to have a procedure like back surgery, or whether or not you qualify for cancer treatment. In the UK, for example, under its single-payer healthcare system, the NHS restricts access to treatments like knee replacements, cataract surgery, and even prescription drugs to deal with common conditions like arthritis and diabetes. If you suffer from any of these ailments or many others in the UK, you might just have to live with it. Let's hope you don't have a medical emergency either. In a January 2018 article in the New York Times, patients in emergency rooms in London are described in having to wait 12 hours before they are attended to. To deal with the situation, hospitals were ordered to postpone non-urgent surgeries until the end of the month. That hardly seems like an improvement over what we have in the United States. Government-run healthcare systems also suppress the development of new cures, medicines, and treatments. Biomedical research spending in the US far outpaces any country with a universal healthcare system, even when you account for differences in sizes of population or economy. Medical breakthroughs rarely come through in countries where government controls the healthcare. Why? Discovering new medical cures and technology is a profitable business, and thank goodness it is. Those profits drive innovation. Single-payer, universal, free healthcare for all might sound great, but like all visions of utopia, they ultimately fail and do a lot more harm than good. Proponents of universal healthcare insist that it would make healthcare affordable to everyone. This is simply not true. Universal healthcare is expensive, really expensive. A recent study by the Mercatus Center at the George Mason University found that a typical single-payer style universal healthcare system would cost around $32.6 trillion over the next 10 years. That number is on top of what the federal government spends on healthcare today. So how would we pay for it? Kenneth Thorpe, a professor at Emory University and a health policy official from the Clinton administration, says, if we're going to go in this direction, universal healthcare, tax increases are going to be enormous. Not just for the rich, but for working class Americans and for the poor. If you need more evidence, just look at the Department of Veteran Affairs, the VA. The VA has existed for over 30 years now, and is a true single-payer healthcare system in our own country. The VA was created to provide healthcare to veterans of the United States military. However, it is a massive failure. In 2014, whistleblowers in Phoenix revealed that 1,700 vets waited on average 115 days just to receive initial appointments. In Fort Collins, Colorado, clerks were instructed to falsify records to show that doctors were seeing more patients than they actually were. And in Columbia, South Carolina, delays in diagnosis and treatment directly led to the deaths of multiple patients. The Obama administration's own Deputy Chief of Staff, Rob Neighbors, revealed that the VA healthcare has a corrosive culture with significant and systemic failures. So what do you suppose the politicians' response to this issue was? To spend more money, a lot more money. The VA's budget has almost doubled since 2009, and they've hired over 100,000 people in the past decade. Wait times have gone up. This probably explains why 67% of all vets, 14 million people, don't use the VA at all, and why those who still use the VA get up to 75% of their own health care outside of the VA system, eventually, or even though they have to pay for it. So basically, whoever can afford not to use the VA doesn't use the VA. So why is it that when the government funds healthcare, it becomes such a massive failure? This is because the government is a third-party payer. Let me explain. Suppose you want to buy something. Suppose you want to buy something for yourself. You have two priorities, price and quality. You want the highest quality for the lowest possible price. Say you want to buy a computer. You have many options, Mac or PC. Mac or PC, laptop or desktop, screen size, memory, price. Only you know which computer best suits your needs and your budget. A lot of companies are competing for your business. You do your research, you make your choice. Next, you have second-party purchases. These are purchases where you're the one spending the money, however, you are not the one consuming. A wedding gift, for example. You care about the price, but not so much about the quality. Finally, let's talk about when it's not your money paying for something and you aren't the one using it. In these instances, you are not concerned about either the price or the quality. A purchase made with money that's not yours. Therefore, you don't care about the cost to buy something you're not going to consume. Therefore, you don't care about the quality. By definition, all government purchases are third-party purchases. The government spends other people's money on things it's not going to consume. It doesn't care about the price or the quality. Thus, there will always be waste in government spending. In the words of Abraham Lincoln, government should only do things for those that a man cannot do better for himself. The sooner we can start making healthcare a first-party purchase again, the sooner Americans can get the healthcare they want. The solution: if 300 million Americans were free to buy healthcare for themselves, just as they do life or car insurance, then insurance companies and hospitals would be working day and night to get our business. Quality would go up, prices would go down. It's already happened with laser eye surgery. Prices would go up, or prices would go down, quality would go up. It's already happened with laser eye surgery. Forbes magazine has found that the price of LASIK eye surgery has dropped 18% within a period of 10 years. That's the way free enterprise works. Free enterprise competition works every time. Today I've laid out the issues with implementing universal healthcare in our country and have discussed how government-funded healthcare would stunt the future growth of medical development. This is more than just a topic of debate. If new ideas aren't challenged, then ideas can become policy real fast. And the cause is irreversible. And it causes irreversible damage. I hope I've been able to persuade you in knowing why universal healthcare in the United States would make healthcare in our country worse. I've done extensive research on the subject and have carefully examined the short and long-term effects. Healthcare is is important, and Americans deserve to have good medical care at an affordable cost. What good is free healthcare if it's hardly even considered care at all? I hope I have been able to provide you with enough evidence so that we can finally put the healthcare debate to rest. Thank you.